And now on the line is Sheila Gilheany. Sheila is the CEO of Alcohol Action Ireland. Sheila, welcome back to Near FM.
Thanks very much for having me on.
Okay, Sheila, yourselves and Alcohol Action Ireland have a webinar coming up on Thursday, the 1st of December. Can you tell our listeners more about what it is about and why you're organising it?
Sure. So we've just come up to our 4th anniversary since the passing of the Public Health Alcohol Act, which was a set of measures that were introduced really to try and reduce the level of alcohol use in the country by about 20%. And now that we're 4 years on from it, we're looking at see, well, how's it going? Has it been implemented fully? What's left to be implemented? And are there threats to it? Are there other things kind of coming along that might actually try to, I suppose, divert us away from that intent of reducing the level of alcohol use? So we're going to have a bit of discussion on that. We have some research that we're presenting about the level of compliance with some of the features, like, say, for example, the compliance with the structural separation in shops. So that's where you would see alcohol products being, alcohol products being displayed in a separated off area. And we're also looking at some other research which looks at where alcohol-free products are being advertised in areas which are actually designated to be that there shouldn't be any alcohol advertising in it at all. So we're kind of looking at that, looking at these threats and things like, for example, the sale of alcohol bill, which is coming up, and kind of asking the question, is our alcohol policy out of balance?
Okay, and you have 3 interesting speakers taking part in the webinar. Can you tell our listeners more about who the speakers are?
Surely. So Dr. Zubair Kabir is from the public health department in University College Cork, and Zubair is the person who's been carrying out that piece of research on the compliance with the structural separation. And then we have Nathan Critchlow, who is from the University of Stirling, and Nathan has been carrying out research around the use of zero alcohol product advertising. And when we talk about this is things like, for example, Heineken Zero, which uses identical branding to its own alcohol product. And we would be, querying, would be saying, well, when you're advertising something like Heineken Zero, are you really advertising the zero alcohol product, or are you advertising the brand name for this very well-known alcohol product?
Because I believe that these zero alcohol products have kind of come out more in the last few years. I think there's only a small number of people buying them, is there?
Well, they're fairly small levels, like compared to, with, say, beer sales overall, they're about 1% like of the zero alcohol products. So they're very, very small amount altogether. And yet you see a huge amount of marketing of it. And we would be saying, well, when you're seeing something being marketed so heavily, and you're seeing it especially being marketed in areas that have been restricted for alcohol advertising, like on the sides of buses, public transport, and billboards close to schools, all of these sorts of areas. We would say that the alcohol industry is making a very determined effort to find a way around those restrictions, and it's using these zero alcohol products really as a means of promoting their alcohol brand.
Okay, just a couple of other related questions, Sheila. How disappointing is it for you on Alcohol Action Ireland to see the government announce their agreement of the sale of alcohol bill recently? I mean, in relation to the opening hours of pubs and nightclubs?
Yeah, well, it is certainly a disappointment, and we would have, along with many other health advocates and public health bodies, would have fed into the consultation on this process and really pointing out that there's a very distinct link between opening hours and density of alcohol outlets with the amount of alcohol that is used, and with that the amount of alcohol harm that occurs. In fact, actually, there's very good research, which has shown that if you increase alcohol hours, you see an increase in harm. There's one particular study which we've been highlighting in Norway, which found that for every extra hour that alcohol outlets were open, you would have seen something like a 15-16% increase in the level of hospital admissions that would go with that. So we're talking about harms like hospital admissions, like public disorder, and indeed actually also things like, domestic violence as well. All of these things are linked to the availability of alcohol, and any increase that you would see in that, whether it's through longer opening hours or whether it's through a greater density of alcohol outlets, we would say, well, this is really going against the intent of the Public Health Alcohol Act. So you have one arm of the government through the Department of Health, which is trying to reduce the level of alcohol use by 20%. And then you have another arm through the Department of Justice, which is putting forward, facilities basically to make it easier to sell more alcohol. And we would say, it certainly doesn't make there's no coherence within it. And we would be saying that we really need to be putting public health, as the primary reason behind licensing. And actually, I found it a very interesting thing that last week, when there was a gambling regulation bill was published by the government, which to me takes a very sensible approach around gambling, and it is recognised that it's a severe risk. Actually, there are many people becoming addicted to gambling and all sorts of serious problems that arise from that. And so there's a set of restrictions that are being proposed around, for example, reducing the amount of advertising that people would see by, for example, putting in a broadcast watershed, so that gambling ads aren't shown before 9 p.m. Now, we have something similar actually for alcohol, but it hasn't actually been introduced. Another very good thing within this gambling regulation bill is the establishment of a gambling regulatory authority, which would take overall control of issues around gambling. So that'll be both including, the issuing of licensing, the monitoring of advertising, and the ability to take action if there are breaches of that of the regulations that are being proposed. Now, we would say we would need something similar for alcohol as well. So that would avoid this thing where you have one arm of the government saying one thing and another arm saying another. You need a central agency which is able to look at all of the aspects around alcohol policy in one place. And I think there's a very good model really from the gambling element of it, which has really, in the establishment of this gambling regulator, it has put public health at the heart, at the reason of why you would have licensing. And that's what's missing from this sale of alcohol bill. It hasn't put public health and safety at the heart of the reason of why you would actually have licensing and advertising restrictions on alcohol.
Yeah, I was just going to ask you actually about your view on the gambling regulation bill, because I saw you sent out a couple of tweets about it last week on Twitter, and you touched on something else there, something that I've heard before in relation to gambling, but I haven't heard of much in relation to alcohol. That's the proliferation of on one hand you have gambling bookies, but for alcohol you have the amount of shops and garages, as well as normal off-license and pubs who can sell alcohol, and they're in some areas more than others. I think if there was, I don't know what the term would be, an alcohol policy regulator, that's something big that could be looked at, is it?
Well, it's definitely something that we have been advocating for the last couple of years. We call it an alcohol office, but it doesn't matter. Some type of state office that takes overall control of all of the issues around alcohol. Another example of it, something that we've seen working very well, is the Road Safety Authority. And again, you have one single authority which is looking at many different aspects of road safety. So that's, licensing of vehicles, licensing of individuals to actually drive, road safety measures, as in, the upkeep, like should roads be better aligned, things like that, and the overall direction of, say, fines and things like that. That really actually will make a difference, is because there's no single one thing that actually reduces deaths on the road. It's a whole big combination of all of these areas. And we have seen over the last 20 years since the Road Safety Authority was established that the level of road deaths has reduced. And, it's not perfect, and unfortunately people still die too often, too frequently on our roads, but it has definitely come down in the last number of years. And we would say, when you're looking at alcohol deaths, 4 people every day die from alcohol. So that's over 1,400 people every year. And, if we were seeing that same level of death on our roads, we would have said, oh my God, we have to do something about that. And indeed, there was good action taken. But we're not seeing the same serious government intent to reduce those alcohol deaths.
Yeah, just in relation to the sale of alcohol bill there we discussed about, I personally wouldn't be surprised in the slightest if this government or a later government watered down the law on the longing opening hours, because they did so, I know, at least in relation to pubs during the Celtic Tiger in Ireland when a lot of people were drinking harmfully. Do you remember that yourself, Sheila, do you?
Well, I know there has been changes, and sometimes indeed proposals, are put forward, and then as a bill would go through the Oireachtas, changes do get made. So certainly we would be advocating very strongly for those changes. And the first sort of way in which that can be done is that the legislation is subject to pre-legislative scrutiny, is be what is called, and that would be done by the Oireachtas Committee on Justice. And we have approached them, and they have asked us to make a submission about our concerns on that. So we would hope that committee would look at the public health aspects of this and put forward a report, outlining reasons why there should be changes. I do understand the sale of alcohol bill was also about trying to streamline some of the ways in which licenses are applied for and how they're actually granted, and I have no problem with that. I mean, there's no point in having people going around the horses and trying to do things in a more complicated way than needs be, but that's not the same as saying that it's okay to actually extend licensing hours. That's a different matter altogether.
Yeah, on the one hand, I kind of understand where the government are coming from in relation to tourists, because I believe in a lot of continental Europe, nightclubs and pubs open later, so I can understand trying to appeal to that market. But on the other hand, personally, if I lived beside a nightclub and that currently closes at 2 or half 2, I wouldn't personally like it to be open till 6 o'clock in the morning, with all the problems that entails. You're calling for, so you already mentioned this, but can you tell me what's the term again? You're calling for an Office of Alcohol Control, is it?
Yeah, well, the term we've been used is a State Office for Alcohol Harm Reduction, but basically a single office that would look at all aspects of alcohol policy. So that would be things like the licensing of alcohol for sales, like the monitoring of the advertising and the putting into place, making sure that things like a broadcast watershed would be implemented as soon as possible, and also things like being able to gather statistics on a very regular basis about issues around alcohol, so that all of that can go in to inform our alcohol policy. At the moment, there are some statistics which are gathered, but they're not necessarily done on an annual basis, and sometimes they refer back, to previous years, and they can be out of date in terms of, say, for example, the costs that accrue to the government because of alcohol harm. So we think that there is a case to be made for a strong policy unit which would be gathering all of that data on a very regular basis, and indeed publishing it as well, so that people can see what is the impact of alcohol use in Ireland.
And would yourselves and Alcohol Action Ireland think that calling for getting this office established kind of goes hand in hand with the rest of the implementation of the Public Health Alcohol Act, the part of the Act that hasn't been implemented yet?
Well, our ideas on an office aren't part of the Public Health Alcohol Act, but what we would say is, that the Act is the first step towards actually taking a public health approach to alcohol, and certainly the measures within it are very welcome. I will say that they were watered down from what was originally proposed back in 2012 with the report of, there was a report that would have come out at that stage about alcohol use, and it was a very, very good, very powerful report. There was a committee on it which would have been chaired by the former Chief Medical Officer, Dr. Tony Holohan. And it, for example, would have said there is a need for a ban on sports sponsorship. Now that got watered down in the final piece of legislation to, some restrictions on alcohol advertising on the pitches, or the grounds of, the field of play where sport was taking place. But it's not the same as actually saying a complete ban on sports sponsorship. So there's things like that we know that with better focus, better research, better, I suppose, attention to the issues around alcohol harm, you could make progress on having a whole of government approach to the issues around alcohol use.
Yeah, I believe Dr. James Riley was the Minister for Health back in 2012. I know he was. I saw him on RT Primetime, a couple of programs in the kind of that time period, those few years, talking about alcohol advertising. I know he was a big advocate for saying that all alcohol advertising with sports should be banned. So
Yeah.
he had a lot of input into getting the Public Health Alcohol Act off the ground, did he?
Yeah, and indeed as well. And I mean, there's a number of, there were a number of very dedicated politicians, around that. But, people unfortunately, not unfortunately, but, just the nature of it, people will move on. Whereas what's really needed, I suppose, is a core group, within the government, like, as I say, something like this kind of alcohol office, or in the way that you have like a statutory authority for road safety, that's there all of the time. And, you build up that, policy expertise and knowledge of what's needed. And because, of course, these things are always changing. So, for example, in the Public Health Alcohol Act, there's no mention there made of internet advertising, the advertising of alcohol on the internet. So the restrictions that are around alcohol advertising are really confined to broadcast media or to outdoor advertising, or in magazines, publications. But we know that what has really taken off in the last number of years is, is the internet, and there's a huge amount of advertising which is completely unregulated in relation to alcohol. And just going back again to the gambling thing, I thought it was very interesting that one of the things that was being made clear in the bill for gambling regulation was a complete ban on internet advertising. And I just thought, yeah, well, that makes an awful lot of sense. And that wasn't included in the Public Health Alcohol Act. So as I say, that's just another example of how, things move on. You need to have, constantly looking at, well, what are the issues that are now, at play around alcohol? Because the one thing we can be absolutely sure of is that the alcohol industry are certainly not sitting back and doing nothing. They are constantly looking to see, well, where are other areas? How else might we promote this product? And we certainly are looking at things like internet advertising and doing it in very, very copious quantities and in a very targeted way as well.
Yeah, I'll come back to you and talk to you about all this again, Sheila. I won't keep you much longer. I was thinking of it today. I'm in my house, and I have the house to myself, and it's nice and quiet. I know the World Cup started yesterday, I believe it was, and I just find it very reassuring that, along with the kind of restrictions on alcohol in the stadia in the World Cup, like, it's the World Cup. This is, I could be wrong, but this is the first time I remember anyway that it's not been held during the summer, and it's been held during the winter. You can be corrected on that if you want, but like, I think when the World Cup and the World Cup is such a big sporting event that when it's held during the summer, this is a politically incorrect word, but I think to a lot of people it's like a big piss up, and it's just the whole alcohol and the football go hand in hand, and I just find it kind of refreshing that this year's World Cup in relation to alcohol, I know Ireland are not in the World Cup now, but I find it refreshing that there's not that same kind of avalanche of alcohol use. Do you have any thoughts about that?
Well, we would be very clear that the linkage of sport with alcohol and alcohol marketing and advertising is is a very dangerous link that's there. So, the World Cup is sponsored by Budweiser, and we know that there will be an awful lot of alcohol marketing that will be associated with that. So we don't think it's a good idea. To be honest, I'm not sure of the difference between it being held in, winter months versus summer months in terms of consumption. I just couldn't answer that, and I don't have any data on it at the moment. I'd say at the end of the year and worldwide, there would be sort of, statistics would be published about that, but I just don't have that at the moment. We certainly know that the one thing that the alcohol industry are keen to do with sports sponsorship is to really harness people's love of the game, that attachment that they have to the sport, to the excitement and to the passion that they would have. And it's all about hooking new people as well. Particularly, there would be a lot of children, who are getting excited about sport or following a particular team. And for them, what the industry are doing is really trying to capture that passion that people have for their sport, for their team, and then to associate that with a particular alcohol brand. And we know it's very effective because, and indeed the industry know it's very effective because they wouldn't be pouring millions into these sports deals that they have. And, when we look at what was done, say, for smoking, one of the most effective things around changing attitudes and to changing the levels of smoking was to firstly to ban the sponsorship of sports events. And then that was then extended into a full ban on advertising.
Okay, Sheila, before you go, your seminar, can you just give out, or your webinar, can you just give out the details again of when it's on and that kind of thing?
Surely. So it's on Thursday, the 1st of December. It's at 11 a.m. It's a webinar. If you just wanted to search on us, alcohol policy, out of balance alcohol policy in Ireland, you can sign up for it on Eventbrite.
Okay, thanks, Sheila.
Thank you indeed.